Hey everyone, Dr. Tran here to answer your questions about minimally invasive bunion surgery. So what is a minimally invasive bunion surgery? Traditionally speaking, bunion surgeries were usually performed through relatively large incisions, around 5 to 7 centimeters. And that incision usually spanned from the toe all the way back. Now, with the advent of new technologies as well as new techniques, we've been able to shorten those incisions just down to 1 centimeter, which is about the length of the tip of this pen. And we place those 1 centimeter incisions throughout the foot. And by having these smaller incisions, we greatly reduce the complications that are usually associated with such large incisions in the traditional approach. So what are the benefits of minimally invasive bunion surgeries? Well, there are a whole slew of benefits. One of them is that since we're not making a very large incision, it usually decreases the risk of surgical site infections. But in addition to that, because the incisions are so much smaller, the cosmetic result is usually much better. One of the other benefits of a minimally invasive approach means that we have much less scarring because our incisions are so much smaller. And what the less scarring means is that there's less rehabilitation. Traditionally, with a traditional bunionectomy, we would have to make a large incision that goes down to the joint capsule, and that would usually result in some sort of joint stiffness that would need physical therapy to work through. Now with our smaller incisions, that means much less scarring and much less rehabilitation. So with all the benefits of a minimally invasive approach, there has to be some cons, right? And there absolutely is. One of the things that I find from minimally invasive bunion surgeries is that it can't be applied to all bunions. Now, although many bunions in terms of the severities are candidates for a minimally invasive approach, there is one type of bunion that doesn't respond well in my experience, and that's bunions that have some sort of arthritic condition associated with it. So if a bunion is allowed to linger for long periods of time, the first metatarsophalangeal joint, or the bunion joint, can actually start to degrade. And when it starts to degrade and there is loss of cartilage, these type of bunions don't typically respond well to a minimally invasive approach and would be best served with a traditional bunionectomy or a traditional open approach. So what does the recovery period look like for a minimally invasive bunionectomy? Well, luckily, because there's less scarring, the recovery period is usually much shorter. So typically for my patients, they're usually walking the first day. So right after the surgery, they're walking in a surgical shoe. And they typically stay in that surgical shoe for around 4 to 6 weeks. And around the 4 to 6 week mark is when we transition them over to a regular sneaker. Now, this is very different from the traditional approach because traditionally we would have to keep the patient off their foot with a crutch or a knee scooter, and only after 6 to 8 weeks can we even start to think about putting the patient back on their foot. So this recovery period is vastly different compared to if you go with a minimally invasive approach where we get their foot into a normal sneaker just within 4 to 6 weeks. So how do you find a surgeon that performs a minimally invasive bunionectomy? Well, luckily, more and more foot and ankle surgeons are getting trained on this procedure. But the best thing that you can do now is hop on Google and Google search minimally invasive bunion surgeries in your area and find a surgeon that is competent in performing these procedures. Make sure to meet with that surgeon, make sure that you're comfortable with them, and that way you can ensure that you're getting the best care possible.